Hi everyone, this presentation will focus on diabetes type 1, also known as diabetes mellitus type 1. This presentation was created by Claire, Amy, Freshta, Kenzie, and Lara. The presentation will go over the pathophysiology of type 1 diabetes, the risk factors involved, the signs and symptoms, the diagnostic testing, clinical and medication management of the disease, and the complications involved. We used a concept map to create a visual representation of the information we gathered about diabetes mellitus type 1. So we use this to make connections and have a look at the bigger picture of the disease. And we did this through the use of arrows and text to link the information that we found. Pathophysiology of the patient diagnosis. So diabetes mellitus type 1 is an autoimmune disease resulting from destruction of insulin-producing cells in the pancreas, which leads to failure to secrete insulin. Individuals suffering with type 1 diabetes are insulin dependent, meaning they rely on insulin injections to replace the insulin that cannot be produced in the body. Insulin is required to allow glucose to enter the body cells and be used as a source of energy. If the body doesn't receive insulin, the body utilizes its own fat to replace glucose as a source of energy and releases a chemical substance known as ketones. Furthermore, buildup of ketones can lead to a serious condition also known as ketoacidosis. The specific cause of diabetes mellitus type 1 is unknown. Genetics and the environment play a big role in the development of the disease. Some individuals also carry genes making them more susceptible to develop diabetes. In susceptible individuals, viral infections may also be a trigger through the production of antibodies that prompt an autoimmune response against the beta cells. Risk factors associated with diabetes mellitus type 1. The main risk factors linked to diabetes mellitus type 1 include family history. So an individual having a parent or a sibling with type 1 diabetes has a higher chance of having the same type of disease. If both parents have type 1 diabetes, the risk is even greater. Linked with family history is genetics. So genetics plays a big role as well. The presence of particular variants genes increases the risk of developing the disease. Another factor is age. So type 1 diabetes can be developed at any age, although development is very rare at an older age. Typically, children between the age bracket of 0 to 14 is most commonly to be diagnosed with diabetes type 1. Statistics from the International Federation Atlas, their key findings show that 542,000 children have type 1 diabetes globally, and that Europe has the highest number of children living with diabetes type 1. Geography is another factor that may increase the risk of developing the disease. 37% of all adults living with diabetes live in the Western Pacific region, which also includes Australia. In Australia, all types of diabetes are increasing in prevalence, and diabetes type 1 accounts for 10% of all diabetes and is increasing. Signs and symptoms of diabetes mellitus type 1. So signs and symptoms of diabetes type 1 can occur suddenly and can include excessive thirst and frequent urination. So when insulin levels in the blood are too low, glucose levels build up over time, spilling over into urine. Sudden weight loss and extreme hunger. So due to the body losing sugar in urine instead of absorbing it, it results in a calorie deficit. Blurred vision. High blood glucose levels pull fluid from the tissues of the body. This includes the lens of the eye. It makes it difficult for the lens to change shape when focusing on objects, causing blurred vision. Compromised immune system and slow wound healing. High blood glucose levels impair the function of white blood cells and circulation throughout the body. Other signs and symptoms can include feeling tired and lethargic, mood swings, headaches, feeling dizzy, leg cramps, and also weight gain. In the most extreme circumstances, diabetes mellitus type 1 results in ketoacidosis, where the body starts to burn fat and body tissue for energy, releasing toxic acids called ketones, causing symptoms such as heavy or labored breathing, nausea and vomiting, stomach pains, and unconsciousness. Diagnostic testing for diabetes mellitus type 1. Type 1 diabetes mellitus can be diagnosed through several tests, including a fast blood glucose test. So this is where a small blood sample is taken, usually after an overnight fast. Fasting allows doctors to observe how the body manages blood glucose levels without food intake. Results of 7.0 millimoles per litre or higher on 2 separate occasions are indicators of diabetes. Another test is the oral glucose tolerance test. So following a fasting blood test, a patient is given a sugary drink to consume. Over the next 2 hours, they will have their blood glucose level monitored, and at 2 hours post-load, a patient's blood glucose level of 11 millimoles per litre or higher is considered to be diabetic. Another test would be the random blood glucose test. So a blood sample is taken at any time regardless of the last meal, and a reading of 11.1 millimoles per litre or higher is suggestive on diabetes, especially when paired with relevant symptoms. Another test would be glycated hemoglobin test. A blood test will indicate the average blood glucose level of a patient for the past 2 to 3 months. This is done by measuring the percentage of glucose molecules attached to hemoglobin of red blood cells. A percentage of 6.5 or over is considered to be diabetes. Clinical management of the patient with diabetes by the healthcare team in a hospital setting. Healthcare professionals provided to patients with type 1 diabetes should involve a physician-coordinated team, which may include nurses, dietitian, and pharmacists. Clinical management can include glycemic control, so monitoring and reducing average A1C to below 7 and using insulin therapy. Monitoring blood glucose levels every 4 to 6 hours, offering a diabetic diet and a healthy eating plan, monitoring complications. A1C can be a strong predictor. Glucocorticoid therapy and intravenous insulin infusion therapy can be used for critically ill patients, and emphasizing self-management after discharge, such as carbohydrate estimation, self-monitoring of blood glucose, education about medication, and hyperglycemia. The management should be developed as an individualized care plan involving patients and their families and healthcare team, taking in consideration the patient's situation, such as age, culture, preference, complications, and any other medical conditions. Medication management for diabetes type 1. Diabetes type 1 management is to keep the blood glucose levels within a target range as close as possible. However, the range may change depending on the individual. Diabetes type 1 can be managed with insulin replacement through lifelong insulin injections or the use of insulin pump, monitoring blood glucose levels frequently, and following a healthy diet and completing regular exercise. Insulin works more effectively when it's injected into the fatty layer of the skin, just beneath the skin and above the muscle, also known as a subcutaneous injection. It is recommended to be injected into the abdomen, however, thigh or buttocks may also be used. Insulin is vital for converting glucose into energy and for decreasing the amount of glucose in the blood. Therefore, it is vital for insulin to be delivered to the person, as the pancreas cannot produce insulin or produces little insulin. Insulin is commonly delivered through an insulin syringe, so this is a single-use syringe and ranges from different lengths and sizes depending on the amount of insulin needed to be delivered. Insulin pens can also be used, so these are automatically filled or refillable with insulin cartridges. Also ranges from different lengths and sizes to cater for the individual's needs. Another method is the insulin pump. So this is a device that's worn on the body 24 hours a day and delivers a continuous dose of insulin when needed through a thin plastic tubing called an infusion set. There are 5 different types of insulin to allow for treatment to be tailored to the person's need. The doctor or a credentialed diabetes educator will decide on what insulin is best to cater for the person's lifestyle and blood glucose level targets. The first type of insulin is the ultra-short-acting insulin. This works within 15 minutes after injection and is important to eat within 15 minutes to avoid hyperglycemia. Ultra-short-acting insulin is given as a bolus dose to keep blood glucose levels within a target range after meals. This insulin is a peak action of 1 to 2 hours but continues to lower blood glucose levels for 4 to 5 hours, known as NovoRapid. The second type of insulin is short-acting insulin. So this works within 30 minutes after injection and is important to eat within 30 minutes after the injection. This insulin is given as a bolus dose to keep blood glucose levels within a target range within meal. Short-acting insulin has a peak action of 3 to 5 hours and continues to lower blood glucose levels for another 6 to 8 hours, also known as Act Rapid. The third type of insulin is intermediate-acting insulin. So this starts to work within 1.5 hours after injection and has a peak action of 4 to 12 hours after being injected and lasts for 16 to 24 hours. This insulin is usually given once or twice a day to help keep blood glucose levels within target limits. This insulin is known as prostafane. The fourth type of insulin is long-acting insulin. So this provides a constant release of insulin over 24 hours. Therefore, it is important to be injected at the same time each day, known as Mellitus. The fifth and last type of insulin is mixed insulin. So this is where two types of insulin is in one injection. For example, an intermediate acting insulin combined with either an ultra short or short acting insulin. This insulin continues to lower blood glucose levels for 24 hours. With this type of insulin, it is important to check with your general practitioner when prescribed this insulin, as depending on what insulin is chosen, it may require eating immediately after or within 20 to 30 minutes. Managing diabetes is important for long-term health of individuals, as over time, diabetes can cause significant damage to the organs, blood vessels, and nerves. The complications of diabetes are severe. However, with appropriate lifestyle changes, close monitoring of blood glucose level, and the use of medication, we can reduce and avoid the severity of these complications. The short-term effects of diabetes are the symptoms associated with the beginning stages of the disease, and when the blood glucose levels are not within the normal range. These short-term effects include excessive thirst, frequent urination, lethargy, blurred vision, extreme hunger, weakness or shaking or agitation, or the feeling of confusion. These are the common complications to diabetes. Another complication to type 1 diabetes is diabetes ketoacidosis. This is usually the first indication that a person has diabetes type 1. Due to the lack of insulin that occurs in the body cannot utilize glucose correctly or as a source of energy. Therefore, the body starts converting fat into energy. When fat is broken down by the body, it releases a chemical substance called ketones, and when there is a buildup of ketones in the blood, it becomes acidic. Signs and symptoms of diabetes ketoacidosis is frequent urination, extreme thirst, abdominal pain, fruity breath smell, confusion, weakness, and cold skin. Furthermore, long-term complications specific to diabetes type 1 include celiac disease, depression, persistent infection, lipohypertrophy, and more. According to Diabetes Australia, diabetes is a leading cause of blindness in the working age adults. It is a leading cause of kidney failure and dialysis. It increases the risk of heart attacks and stroke by up to 4 times. It is a major cause of limb amputations, and it affects mental health as well as physical health.